I was born and raised in Columbus, Ohio. Grew up there, went to The Ohio State University, and interviewed at The Ohio State University and came out here to work for Caterpillar. My wife and I have been married almost 50 years. I've been diabetic, it'll be 60 years in March. And I've seen quite a few changes in 60 years. I remember we went to the family doctor. I had lost, at that time I was very thin, if you can imagine, but I continued to lose weight, and my brother and sister and mom and dad got the old Encyclopedia Britannica out and tried to look through that to find symptoms that matched mine to put a name with it. Couldn't do it, so they took me to the doctor and he checked me over well, checked my urine sugar, checked my blood sugar, and said, "You're diabetic." I had a tremendous trust and faith in my parents, and my parents were very reassuring outwardly to me. I think between the two of them, they were very nervous, but I felt pretty comfortable, to be honest with you. I think it was because I didn't know any better. I've thought about it a lot over the years, and I think it may be better in some regards if a person is diagnosed at a young age, so they don't have so many habits to change. I sat down yesterday and tried to calculate how many insulin shots I've taken in almost 60 years. And I came up, not anything scientific, but I came up with somewhere between 75 and 100,000. And that's a lot. You can lead a normal life, but you have to do a little bit extra to do that. When I was first diagnosed, they said that the disease would take a third of your lifespan. So if you were on a curve where you were expected to live to be 60, you could expect to live to be 40. Now that has changed because techniques to monitor and control it have gotten better. But that's still kind of frightening. So I guess what I would tell newly diagnosed people is learn as much as you possibly can. Work with doctors who are willing to share information with you. My folks built the foundation for me to take care of myself. They're gone. I hope they're looking down and they're proud. And most of all, I want to thank my Lord and Savior, Jesus Christ, who is truly the best doctor that you can ever have for anything.